Chapter 34, Dental Hand Instruments. There are a wide variety of dental instruments that are used in dentistry today. Dental supply companies manufacture many variations of instruments for the purpose of accommodating personal preferences. Identifying hand instruments. Dental manufacturer assigns a number to most instruments. The dentist will often refer to pliers and forceps by their number rather than their name. Advantageous to learn both the number and the name. Hand instruments are designed with three specific parts: the handle, the portion of the instrument that the operator grasps, the shank, the part of the instrument that connects to the working end and the handle, and then the working end, the portion of the instrument designed for a specific function. Black's instrument formula. Black designed a formula that describes the angulations and dimensions of the working end of a hand instrument. Hand cutting and scaling instruments have three sets of numbers that identify the following: the width of the blade, the length of the blade, and then the angle of the blade. Instrument classification. We have examination instruments, hand are manual cutting instruments, restorative instruments, and accessory instruments. Instrument sequence. Procedure tray is set up from left to right based on how instruments are transferred and used throughout a dental procedure. The clinical assistant uses the left hand when transferring instruments. Most frequently used instruments should be placed closer to the dentist for ready availability. Examination instruments are the most often utilized instruments on the tray and can be used in procedures ranging from checking a specific problem, providing a thorough oral examination, and evaluating a restored tooth. Your basic setup is the mouth mirror, explorer, and cotton forceps or pliers. It's best to position the explorer first and the mirror second on the tray. Hand or manual cutting instruments is the next group of instruments placed on the tray setup after the examination instruments. Dentists will have a preference as to what instruments they want to include in this section. A combination of rotary instruments and manual cutting instruments interchangeably throughout a procedure. Restorative instruments are used to place, condense, and carve the restorative dental materials back to reflect the normal anatomy of that tooth. Instruments selected for the tray setup vary with the dentist's preference and the type of dental material selected for the procedure. Accessory instruments and items are not necessarily included in the tray setup, but can be pulled from the dental cabinets or tub and used for many procedures. When additional items are used for a procedure, you must follow proper infection control guidelines regarding disinfection or sterilization of the item before you place it back. Preset cassettes or trays, hand-given instruments, and related accessories for a given procedure are prepared, stored, and transported together, including examination, hygiene, restorative, crown and bridge, and surgical. Storage tubs. Supplies and dental material for specific procedures can be stored in a covered plastic tub within each operatory. The combination is known as the tub and tray system. Color coding systems. One of the most convenient and efficient ways to organize instruments and supplies for specific procedures. Instruments with bands of the same color, tray of the same color, or tub with dental materials of the same color.